These are four conditions that disproportionately and differently impact women. Number one, 80% of all autoimmune disease patients are women. I'm talking about lupus, rheumatoid arthritis, Sjogren's disease, Graves' disease, multiple sclerosis, myasthenia gravis, psoriasis. Number two, 2/3 of all Alzheimer's patients are women.
Boy, those numbers are shocking. Dr. Erin Nance is an orthopedic surgeon who has become a real-life Meredith Grey from Grey's Anatomy. She goes by Little Misdiagnosed on social media, and she spotlights medical conditions on social media that are often misdiagnosed in women.
She also co-hosts the Medical Detectives podcast, sharing strange hospital stories, and she just released a new book, Little Misdiagnosed, A Surgeon's Guide to Breaking Bones and Bending Rules. Dr. Nance joins us now. Good morning.
Good morning. I'm coming to you live from Charleston this morning.
Nice. Well, you know, technology changes so fast, and now it makes me wonder, do I want the older, experienced doctor, or do maybe the younger people know a thing or two that the older ones don't? How's that playing out?
I think there are benefits to having all different types of physicians. You know, people will say that the physicians who are more experienced, they have seen more cases, they've seen more interesting cases or difficult, unique cases in their life. But for the younger physicians, they're the ones who are coming out with brand new knowledge. They know all the new technology. So in the end, I think it's what is the best relationship that you can have with the doctor that you have.
What you had those numbers off the top about the number of women, 2/3 are the ones diagnosed with Alzheimer's and also the autoimmune. Why is this affecting women so much more, and why are women being misdiagnosed more than men?
Well, we do believe that there is some link to either estrogen levels of the body or, listen, every one of our cells is different from men. And what I think this really boils down to is women have been left out of research for so long. It wasn't until 1993 that women were even required by law to be included in research. So many of the conditions that we know, all of the literature, all of the education that even the doctors know about are based on studies that were done primarily on men. So going forward, we are really looking for more research dollars to research these conditions that significantly impact women.
Is there a difference between the way women go to the doctor, the questions they ask or don't ask versus men?
Well, I will tell you that there is definitely a level of bias when a woman versus a man, say, enters the exam room or even the ER. For example, if you are a 50-year-old woman and you present to the ER and you say that you have shortness of breath and difficulty breathing, they're going to diagnose you with a panic attack and send you home.
Wow.
Versus if you were a man, you are going to get an EKG, you are going to get a troponin level and make sure you're not having a heart attack.
Are you serious?
So,
that can't be right. They're sending a woman with chest pain home. Does that happen most of the time in your experience?
that happens so many times.
Wow.
I have almost 1 million followers on social media, and these are the posts that I think it's really validating for people to see a doctor speak out about these scenarios and these things that are happening in real life. We're not making these scenarios up.
Unbelievable.
You talk about some procedures you say people should not get or be wary of. One of them is LASIK, and I've had it, and it's been fantastic. But I did have the doctor tell me that people where it goes wrong are patients who should never have gotten it, but some doctors will do it no matter what because they want the money. What are your thoughts on that?
This was actually a post that I made about my personal experience with LASIK. I have been left with severe dry eye since I had surgery. I had surgery by a phenomenal surgeon. I think the surgery itself I have perfect 20/20 vision, but the side effect that I have now, which is everyday pain, which is something I did not have prior to undergoing LASIK, is just something that it's very difficult to, and listen, I am a surgeon. I know that there are risks and benefits to every type of procedure, but it's very difficult to get a patient to understand what a certain risk or what a certain side effect would be if you've never even experienced before. So I do just recommend for everyone to get as many different second opinions, listen to people who have had the lived experience with this disease or condition or procedure. And there are so many people on social media who are giving their experience. You shouldn't be taking their experience as the doctor's advice, but you should be able to understand and get a variety of opinions.
So your book is a collection of essays. Are these stories that people have told you about their experiences, or is it something different?
So the book is actually a collection. It's a memoir. It's about my time in residency, in training as a female in orthopedic surgery. And the first chapter is about my very first day of work as an orthopedic surgery intern. And my brother was in a diving accident, broke his neck, and became a quadriplegic.
Oh.
And so this is about how that accident shaped who I became as a doctor.
Wow. You also talk about some mysterious diseases. Maybe we can just address one. What is vampire disease?
So this is actually a story that was told by one of our guests on the podcast, The Medical Detectives, which is actually a patient storytelling. So if you like kind of Dateline crossed with Grey's Anatomy, this is absolutely the podcast for you. But this was Leah's story, where she was getting all these mysterious blisters and kind of really bad sunburns whenever she was out in the sun. And what it ended up being was a disease called porphyria, which if you have ever heard of Mad King George, right? Some illness that made him go crazy. This is that same disease. It's actually a medical liver disease. And many patients are being misdiagnosed with psychiatric illnesses.
Oh, boy. Well, you know what? You can follow her on social media. She answers a lot of questions there. And the book is Little Misdiagnosed, A Surgeon's Guide to Breaking Bones and Bending Rules. For more, you can check out Dr. Erin Nance on all of her platforms. Thank you again for being with us. Her podcast is also The Medical Detectives, and she also has an upcoming medical platform, Feel Better Health. Thanks, Erin.
Thank you so much.